Did you know that the excessive intake of vitamin D supplements can lead to hypervitaminosis D, which can cause hypercalcemia, leading to symptoms like nausea, weakness, frequent urination, and severe cases of kidney damage? Or that deficiencies in certain B vitamins like B12 and folate can lead to mood disorders such as depression, anxiety? So take a deep dive with us as we expose a shocking decline in food nutrient content over the last 50 years and reveal how your supplements could be doing more harm than good. Yeah, so that's right. I read somewhere that 77% of the US population uses some sort of supplement, but many of them aren't using it correctly, right? Or not dosing it, or not, using the ones that address their deficiencies, right? What's your take?
Well, I feel the issue is not so much a lack of education, but rather the under-discussed topic of proper supplement intake. Oftentimes, medical advice on supplements is pretty limited. Without prescriptions, people can rely on influencers, podcasts, or bro science to make decisions about what supplements to take. According to the newest research on supplement consumption, the most popular supplements people in the U.S. take are vitamin C and D, magnesium, fish oil, coenzyme Q10, and multivitamins. The main concern of all of this supplement consumption is the fact that overlapping these ingredients can oftentimes lead to interactions.
High doses of caffeine and weight loss supplements can be what? Dangerous for those with heart conditions. Wow, right? But an advanced basic is how ephedra and weight loss supplements in the 90s actually caused deaths. Yes, deaths of NFL players and pro athletes before it got banned, right? To the FDA's concern of heart attack, seizure, stroke, and sudden death, right?
Yeah, and the reality is that the supplement industry has fairly lax regulation in comparison to pharmaceuticals. And so the risk of adverse reactions, including allergic reactions, is going to be higher in this group.
What about the other side? Like hypervitaminosis? So how does, excessive vitamin intake impact our health positively or hidden dangers?
For example, excessive vitamin A intake can lead to symptoms like vision changes, liver damage, bone pain, skin changes, nausea, vomiting, or diarrhea. Vitamin D overdoses could result in nausea, vomiting, poor appetite, constipation, weakness, weight loss, and kidney stones. Excessive vitamin B6 can cause nerve damage, muscle weakness, skin lesions, and sensitivity to light.
Wow, it's just crazy. So even commonly used supplements like vitamin C can have adverse health effects, right? That's kind of strange, right?
Well, while vitamin C is generally safe, if you eat too much of it, it can cause stomach issues. In extreme cases, contribute to kidney stones and iron overload. Modern diets oftentimes lack sufficient nutrients, and that's why we need to supplement ourselves with these.
Yeah, because it's kind of also concerning to hear about the decline in nutritional content in our foods. Great example, over the last 50 years, potatoes have lost 50% of vitamin A, C, and D, and 20% of calcium, like soil depletion, modern agricultural practices, crop selection, and pesticides, right? And so this is kind of a little concerning. What are we taking? What are we eating? And it basically kind of raises some questions about food sources. So what about your take on the choice of supplements?
Ideally, you want to read your labels carefully. Some brands can offer limited nutrients or even contain harmful elements like heavy metals and chemicals. Try to find supplements, as I mentioned, that are CGMP or have the Certificate of Good Manufacturing Practices.
I hate to double click on this, but just taking it because you heard about a supplement on the Huberman podcast or some influencer may not be the best idea for you. But Dr. Ryan, I guess getting back to the importance, are there certain micronutrients that are timeless, universal, like they're just, you see it over and over again?
There are a couple that are very, very important universally. These include functional foods, vitamin D, a multivitamin, omega-3, and probiotics.
All right, functional foods, what the heck? What do you mean? What are those?
So when I talk about functional foods, I'm really referring to nutrient-dense vegetables, fruits, legumes, and fermented foods. These all provide essential nutrients and aid in digestion as well as improve gut health. They're rich in antioxidants and phytonutrients, which can help with arterial health and cholesterol management.
We also notice this trend with a lot of our clients, right? And it's a vitamin D deficiency. Why is that so important? Why do we see this?
Yeah, this is a big issue. So vitamin D is crucial for gene regulation and disease prevention, from heart disease to the common cold. It's produced through sun exposure, and it typically takes about 15 to 20 minutes daily. However, factors like sunblock use, dark skin, and excess weight can affect its production as well as storage in the body. Some studies suggested vitamin D can reduce cancer risk by 67%, half your heart attack risk, lower blood pressure, improve insulin sensitivity, maybe even decrease your flu risk.
Okay, now shifting gears here on the fat side, what about omega-3s? Fatty acids, since our bodies don't produce them.
So there's a lot of data on omega-3 fatty acids, and they offer significant benefits like reduce the risk of arrhythmias, cancer, and Alzheimer's. They also seem to improve skin health, arterial dilation, inflammation reduction, and boost immune function. Eating fish once a week, that is fish that's very high in omega-3 fatty acids, can reduce your Alzheimer's risk by up to 60%. One way that you can check for deficiency is feel your skin. If it's dry, you have bumps in the back of your arm, you may have an omega-3 fatty acid deficiency.
Now, what about the probiotics, right? It's I've heard it paraphrased as like the glue that holds everything together. How vital are they in your opinion?
Probiotics are crucial for a lot more than we realize. Imbalances in your intestinal microbiome are linked to various conditions, including type 2 diabetes, irritable bowel syndrome, as well as food allergies. They also seem to aid in digestion and reduce urogenital infections.
And thinking about the probiotic sources, right? I think that's something that I see a lot of influencers talk about is yogurt.
Yogurt is rich in probiotics, but a lot of types don't have a significant amount of beneficial bacteria. In certain cases, you might need 74 tubs of some yogurts to match one probiotic capsule. So I wouldn't say yogurt alone is sufficient.
When you look at vitamin and mineral supplement intake, what do you see more common, right? A deficiency or a, overabundance?
Definitely a deficiency. 50% of Americans lack vitamin A, C, and magnesium in their diets. Well, it's essential to know how to take supplements effectively, considering factors like vitamin solubility and potential medication interactions. To start, I would recommend focusing on the elements that we discussed: functional foods, vitamin D, omega-3, probiotics, and a good multivitamin. Obviously, consult with a doctor and conduct tests to determine your specific needs before engaging in supplementation.